Ozempic, Wegovy, Mounjaro get a bad rap sometimes.
So insulin is what we call an anabolic hormone. It's a fat storage hormone.
People don't understand the difference between type 1 and type 2.
But type 1 is associated with complete lack of production of insulin. Type 2 diabetes is exactly the opposite. We don't have that luxury of having the hope of remission.
I hadn't really thought much about insulin. I'd been completely obsessed with blood sugar.
Then you realise when you cut your carbohydrates down in your diet, it wires your brain up.
I have been taking GLP-1s.
You're not storing fat. You're allowing your body to burn it.
People may think, gosh, this is a restrictive way of lifestyle. It is the opposite. It's made me feel free.
Now, I'm grateful for insulin because if I didn't have it, I'd have died. It has to be respected.
I am thrilled to be sitting here with you, Dr. Ian Lake, the doctor that has really changed my life. Thank you for coming down all this way.
What a wonderful introduction, Alice. But it's great to see you again. And the best thing ever is seeing you doing really, really well. And because when we first met, it was a different situation, wasn't it?
Yeah, I would say I was probably at my lowest ebb when we met at Coombe Grove at the beginning of this year. I was completely exhausted, physically, mentally. I was feeling dreadful and completely hopeless, actually. Just wasn't finding answers to manage type 1 diabetes, which I've now had for quite a few years. Diagnosed, well, for me, as you know, it was a tricky diagnosis. It actually triggered when I was around 40, but I was misdiagnosed for a few years as type 2 before everyone realised it was type 1, which is a very different story. And then, so I injected insulin for the first time in 2021, January. And when did we meet? We met at the beginning of this year, so February 2024. And so I've spent a few years trying to figure things out for myself, finding some answers, but not enough answers, and just not feeling as well as I hoped I would. So that's when I found your work and I started reading and researching. And then we finally met at Coombe Grove at your insulin optimization retreat, which was a big investment for me, but the best thing I've ever done for myself and my future.
Oh, fantastic. It's good you say that, because I'd actually met you 6 months before that. And we met, in fact, at Coombe Grove, because you were there for
We were there in passing.
In passing. And I was intrigued, really, to wonder how you would get on having signed on to my course, because it is different in the sense that we don't just look after blood sugar, but we try to study insulin, and I always call it insulin across all routes of health. So it's very what I call holistic. So, you know, when you came along, you'd had a lot of experience of a lot of different ways of managing your type 1. And I was a little bit nervous to think, well, how am I going to put something else across to this person who is pretty expert at managing their type 1 diabetes according to the conventional way? Did you feel expert at managing your type 1 in the conventional way?
Well, my team at the hospital made me feel like I was in control and doing really well.
Yeah.
But I wasn't feeling that well. And so there was a bit of a disconnect. And I now understand that the blood sugar level at which I was living over long periods of time, my HbA1c was around 57, 58, and I was being congratulated on that as it being a good number, a good reading. So I'd bounce out of my appointments and go and treat myself with a croissant for my good behaviour, and just not really feel as well as I hoped.
It's interesting, isn't it? Because I agree with you. I mean, I was diagnosed almost in black and white era in the early 1990s when I was in my 30s. And I was I believed everything I was taught, and why shouldn't I? I believed that all you had to do was count your carbohydrates and then inject your insulin in a timely way. So as the carbohydrates made your blood sugar go up, the idea was to inject your insulin.
If only it was down. As simple as that.
And of course, when we do physical activity, that alters the equation even more.
Yeah.
And the last thing you want is to go hypo. So I tended to run a little bit higher in the sort of 10 to 14 sort of range before I even started physical activity, knowing that it would probably come down later on. So the conventional way for me was the conventional type of diet, the low fat, higher carbohydrate diet, where you count your carbohydrates and learn to inject insulin. And after 20 years of doing that, I knew that I wasn't very good at it.
So during those 20 years, can you remember what your HbA1c was doing?
Yeah, so for a start, I was very, very lucky because I got really into it and I cut down as much carbohydrate as I could inadvertently because I was trying to eat less, and the carbohydrate I cut out was the refined carbohydrates. So it was still porridge for breakfast, brown bread sandwiches for lunch, still 3 meals a day, and I had a young family at the time, so it was a normal family dinner, like meat with some vegetables or probably some potatoes or rice or pasta or something like that. But I cut out the sort of puddingy sort of things and the refined sugars, and I luckily had what's called a honeymoon phase, which is not well understood, but it's that time of your diabetes diagnosis where you start off with a massively high blood sugar, probably ketones, and then in the few weeks following that, you need very little insulin. And it's a wonderful opportunity to actually think, wow, that's amazing. So
yeah, I think I had that too for 6 months.
Yeah,
but
that's right.
Didn't really last longer than 6 months.
Yeah, mine lasted up to 2 years. Then my HbA1c, my measure of long-term control over 3 months every time, went up to, it was about 50 odd for years and years and years and years.
So in the early 50s?
Mid-50s, I would say.
Mid-50s.
But at the time, the NICE guidelines, the National Institute of Clinical Excellence guidelines for England and Wales, was that the HbA1c target was 56. So I was in that range. And it's just that's 7.5% in European and American numbers. So 56 is about that. So I thought, I'm doing okay.
Yeah, that's how I used to feel.
Exactly.
Used to feel.
Exactly. So I thought, well, I'm not doing too badly. And then it went up. I defocused for whatever reason. And then it went up to about 70, which is 8 and a bit percent. And I thought, well, this is not very good. But I was doing quite a busy job. I mean, when I was diagnosed, I felt tired, but there's no other major signs apart from tiredness. I fell asleep in a car wash the day before I was diagnosed. That should have given me a clue. And then I sort of recovered again. And then the next day I had a classic symptoms of peeing a lot and drinking massive amounts. And luckily, as a GP, I diagnosed myself. And
interestingly, I diagnosed myself too.
Did you?
Yeah. But it took me much longer.
Yeah.
But maybe as we've just touched on the symptoms, maybe we should go through that in case anyone's listening to this that suspects they might be going into this type 1 diagnosis.
Yeah.
I didn't know it at the time, but excessive thirst and peeing on a level that is completely unnatural. I had blurry vision.
Yeah.
I had skin infections. I had all sorts of infections, actually, that I couldn't shake off. I was constantly unwell. Candida issues.
They're the classic ones, really.
Breath, smelling strange.
Some people get, that's right. And
towards, as it was getting progressively worse.
Yes. So it does have a run-in phase a lot of the time. Some people present instantly. Where there's something happens and then it suddenly get a...
Well, I know that moment where it happened for me, where I absolutely got beyond, I don't know what the word is. Anyway, I was told I was type 2 around then.
Yeah.
And so I then went into a type 2 lifestyle, but I kind of coasted along as type 1 by not eating carbs during that time.
Yes.
And I lasted for quite a while until I reached breaking point and the symptoms escalated. I had terrible carpal tunnel syndrome. Both my shoulders froze.
Really?
I was in a really bad state. Actually, I even got coccydynia. My coccyx inflamed. Like my whole body was breaking down. And I got myself a GAD antibody test privately and got the diagnosis, and then was handed my first insulin pen and told by the lovely nurse, who I still see now, she said, inject 2 units of this 15 minutes before your breakfast tomorrow.
Yeah.
And count your carbs and inject the appropriate amounts of insulin. And I was on my own then. And
I think that's fairly typical, and it is remarkable how most people manage to do it, really, or make a go of it and don't end up in hospital. It is remarkable to me. So the symptoms you've described are all of the symptoms really of high blood sugar.
yes.
And I think some people, certainly as we get older, there is a peak in the age of sort of 5 to 7, and then another one in early teenage years, and then about a third of us, and myself and yourself, I think, got it at a later age.
Yeah, around 40. Yeah,
that's called LADA, or latent autoimmune disease of adulthood. So you had your autoimmune component of your disease checked by measuring certain antibodies, which show up if you have a type 1 pattern or autoimmune pattern, the anti-GAD antibodies. There are 4 different sorts or 5 different sorts of antibody.
I had 3 of them checked, and they were all positive and off the scale.
Yeah.
I mean, I don't know whether that means you're more severely type 1, or is it all the same? I'm not sure.
Well, I think it's an expression that you have a lot of autoimmunity. It's a little bit like, say, rheumatoid arthritis. Some people,
can you have levels of it?
Some people have less severe rheumatoid, and other people have very actively aggressive rheumatoid.
Okay.
So I think there are levels of.
Yeah.
Certainly.
I mean, there was one that was the range 0 to 10, and I was 4,000.
Yes.
Something ridiculous like that.
So if your pancreas is in a stage of failing, it might fail slowly as we get older. In younger people, it tends to fail more quickly.
Right.
So you may get a slide into your symptoms. You may start losing weight. You may start.
Oh God, I lost about 40 kilos over.
Goodness, you must have,
I was unwell trying to manage my type 2 diabetes, probably for 3 years. Getting progressively worse, which is why I realised something was very wrong. So I also get a bit frustrated that people don't understand the difference between type 1 and type 2. They're very different diseases.
Completely.
I have my idea of the difference, but you're the doctor, so you should probably explain it.
Well, type 2 is more related to lifestyle, but I think some people are predisposed to it. It does run more in families, strangely, than type 1.
There's nobody in my family with type 1.
No, if you have type 1 diabetes, you've got about a 5% chance of passing it on to your offspring or less.
Okay,
it's
that's very low.
It's not very high. Whereas type 2, there's about a 25% chance of you getting it if one of your family have it. But
so a lot of people say, have you got the genetic type? And then they said the one you're born with.
Yeah.
And I'm like, well, it's not quite as simple as that.
Yeah. We don't, unfortunately, know the cause of type 1 diabetes. There are some strong associations, but type 1 is associated with complete lack of production of insulin, or near lack of production, or production that is so low that you cannot maintain your blood sugar at normal levels. Type 2 diabetes is exactly the opposite. It's where your body has way too much insulin, but that insulin isn't working in your body. So your body keeps producing more insulin to bring the blood sugar down. So people with type 2 often have high blood glucose, but more than enough insulin. And people with type 1 have high blood glucose, but there's not enough insulin to bring it down. Whereas in type 2, there's more than enough insulin, but it's not working properly. That's called a metabolic disease.
Insulin resistance.
Insulin resistance, exactly.
And luckily for type 2 diabetics, they can change that resistance, reduce it, become sensitive to the insulin, and reverse their condition.
Exactly.
And live, long, healthy lives.
The earlier you catch it, the more aggressive you are with lifestyle measures, and diet is one of them. And it's the same diet as for type 1, strangely. So the diet's the same that works, but the with type 2, there's a very good chance that you can actually reverse it. The longer you've had type 2, the more difficult it is. But if we pick it up really early, there's evidence that 95% of those people will not progress to type 2 diabetes if they stick to the lifestyle. Yeah. It's remarkable.
When I was misdiagnosed as type 2, I bought all the books on type 2 diabetes and I followed all the diets. Actually, Michael Mosley, our dear departed Michael, his books I've read a lot, listened to his podcasts and programs, and I followed what he said, the 800 calorie diet and intermittent fasting, and he of course was a type 2 diabetic.
Yes.
And I had the opportunity to sit down and meet him earlier this year as well, and maybe it was last year, and we spoke about diabetes, and I told him that I thought all his theories were a fraud because I did everything and it wasn't working for me. And then I said, and then I realised I was actually type 1 diabetic.
Yes.
And so he was type 2 himself, and I asked him, and he was very well managed. And he told me, I asked him, how long being off the programme would it take for you to fall back into a type 2 diabetic state, the blood sugars going up and the insulin resistance to come back? And he was like, about 3 weeks.
Yes.
And I was quite shocked. It's quite quickly that all that good work can be reversed.
Yes. Unfortunately, type 1s, we don't have that luxury of having the hope of remission ever. I mean, there are 1 or 2 cases, but by and large,
I've been searching for those and I haven't found them. I mean, there is some exciting stem cell research going on that I keep a close eye on.
Yes.
Which could be the future of diabetes, more of a cure perhaps than a treatment.
We can hope that, but in the meantime, we have to
manage it
as fit as we possibly can.
Yeah.
In the hope that if a cure does come along, we'll be ready and in the best possible state.
We won't be, with our eyesight failing, our kidneys in trouble, etc.
Yeah.
Which is the route that I was probably heading had I not met you, actually, and changed the way I look at insulin. I hadn't really thought much about insulin. I'd been completely obsessed with blood sugar and sugar and carbs and things. But it's insulin is really the key here, and that's and the retreat that I went on, your retreat, the insulin optimization retreat. It was like doing a masterclass in biology and blood sugar balance, and it was fascinating.
Yeah.
And since we met, I followed your advice quite closely. I've had a few blips in the summer. I took a break and indulged in more carbs than I would do normally, but I quickly got myself back in the zone as I saw my HbA1c rising, as it would. Even though I'm a good diabetic and I don't drink alcohol and I try my best, it started creeping up. Anyway, got it back down, and it's almost a year. So how many months have I been doing this? 10, 11 months. And my HbA1c is 44,
Amazing.
Which is, if you look at the charts, classified as pre-diabetic. So I wouldn't yet be diagnosed as a diabetic, even as a type 1, which is, I imagine, quite unusual. And I didn't think it was possible. I was actually completely hopeless when we met. I didn't think I could get it lower than 57.
And I think the problem is you've hit the nail on the head there, because a lot of my colleagues, my medical colleagues, don't think it's possible to achieve normal blood sugar. And there is a school of thought that says, no, it's absolutely possible. When you said we have a little WhatsApp group that follows on from the Coombe Grove sort of 6-day course. When you said it's 44, I said, that's great, Alice, but I'm not surprised. If you see what I mean, because
you weren't, but I was.
It's fantastic, and I didn't want to give you the impression that I wasn't pleased, but that's what we expect of our people with type 1 who are running insulin optimization.
Yes,
it doesn't matter if you can't quite achieve it straight away. It took you a year, but the key thing about our course and this idea of insulin optimization is you start to learn about your body, how it works. We spend 2 whole sessions on how insulin works. And I saw you got it on day 4 out of 6.
Did I?
I could see the penny drop. And it was literally like pushing somebody on a cycle, when you're teaching your child to ride a bike, and I just let you go. You let yourself go at that point.
Yeah.
And I knew then Alice has got it. And now you can argue your case and be confident that you know that you're doing well. And I think that's quite a gift, because there's a lot of negativity around, if you mentioned the K word, keto, there's a lot of negativity about that. And of course, ketogenic diets are nothing more than allowing your body to burn fat.
Yes.
And we might I think we ought to go into that at some point.
Definitely.
But ketones are discouraged in type 1 diabetes. I was always discouraged from making ketones. My doctor said, you better not get any ketones. If your blood sugar's going up, you've got ketones, you're ill. And absolutely you're ill if you're on a high carbohydrate diet. you shouldn't have any ketones in your bloodstream. So if you produce ketones, your doctor will want to say, well, where are they coming from? Because there shouldn't be any ketones.
No, it's funny. I'm delighted when I see my ketones are elevated, because it's so hard to actually achieve fat burn as a type 1.
Yes.
Even when you're really optimizing your insulin, keeping it right down, it's still really hard to get into ketosis.
That's exactly right.
I find intermittent fasting, which is a big part of your course, really useful. And I've also been a little bit of a maverick in that I have been taking GLP-1s for most of this year as well. And that's really helped with the intermittent fasting bit of this. And type 1s, NICE guidelines do not give type 1 diabetics GLP-1 medication, from what I understand. Typically not. But because I'm an overweight type 1 and curious and able to access private medicine, I booked in with an endocrinologist with a specialism in obesity and diabetes. And so he was able to really see me through it carefully. And also I am quite a sensible type 1.
Yes.
I don't put myself at risk, and I keep a very close eye on myself. So I was confident that I could manage the GLP-1s, and it's worked really well for me. And there were some tricky side effects that I pushed through because I was confident it was a good medication for me. And it gets Ozempic, Wegovy, Mounjaro get a bad rap sometimes. But I think, and yes, there's always going to be 1 or 2 people that have a terrible reaction to a drug. But I think that goes for any drug.
I mean, they need to be supervised closely, I think. But if they're supervised...
I mean, I had all my blood work done, and I check in regularly, and I keep a real close eye on things. And at the minute anything's a little bit awry, I will get some support.
Fantastic. And people say it turns down the noise of wanting to eat all the time.
Oh, massively.
And I think that is what most people say. I woke up and I didn't want to eat, whereas normally they wake up and the first thing they do is searching for food. But
most, a lot of type 1s, I don't, you can tell me this, because you probably have lots of type 1 patients.
Yes.
Do they suffer with weight gain in the way that I have done?
Inevitably, because the key thing about insulin
is that it's a fat storage hormone as well as
their insulin has many actions in the body, and we can talk about those, but it's an energy regulating hormone. But it's the only hormone that reduces blood sugar. So we have to, if you don't inject insulin, your blood sugar goes up. So if you're a type 1 at diagnosis, you haven't got any insulin, surprise, your blood sugar goes up. But one of the ways, so if you eat it, say you eat a chocolate bar, and we're sitting down like we are now, doing not a lot physically, then the glucose will go into the bloodstream and raise the blood sugar. So how do you get rid of the sugar in the blood? Well, insulin does that. It will either do it by encouraging the muscle any acting muscle to take it up. It can store a little bit of it as something called glycogen, which is a glucose storage state. Or, the majority of cases, if we're doing nothing, it will just end up being converted directly into fat in the liver. And then it will very
quickly, in my case.
Yeah,
I gained weight very quickly when I started injecting large amounts of insulin.
Absolutely. So insulin is what we call an anabolic hormone. It's a fat storage hormone. And the problem with type 1 is we put insulin into our skin. So whether we put it in a pen, whether we put it in a pump, whether they have a closed loop hybrid, so-called badly named artificial pancreas, it still goes into the skin. And because it goes into the skin, we need, certainly at meal times, twice as much insulin as someone without diabetes in order to control our blood sugar.
Which is why it's so hard to get into burning ketos,
burning fat. If you're storing fat, the ketosis is basically fat burning. So you burn fat and you produce ketone bodies.
Sure, sorry.
So insulin is a fat storage hormone.
Yes.
And because we inject insulin for meals, we have higher levels of insulin than people without type 1 diabetes, just because of the way we have to have it. Now, I'm grateful for insulin, because if I didn't have it, I'd have died sort of 30 years ago. So I'm grateful for insulin, but it has to be respected. And we have to understand how to use it. The cause of type 1 diabetes is not high blood sugar. The cause of type 1 diabetes, that's a symptom. The cause is no insulin. But in order to be able to control our diabetes, we have to inject insulin. And unfortunately, where we inject it means that more insulin is into the body than we need. And it's there for a longer period of time.
Yeah.
So insulin tends to promote fat storage.
Yeah.
That's why people put on weight with type 1
I mean,
diabetes.
I have, since I've been optimizing my insulin, I have and injecting GLP-1s, I have lost, I think, almost 20 kilos in a year.
Incredible.
But I know that by the way I've been living and what I've been eating, had I not been type 1, I would have lost probably 30 kilos. It's come off very slowly, and it's been very hard work and lots of plateaus.
Yes. Yeah.
But I've got a missing piece of my puzzle, which is my activity levels, my exercise. But now that I've dropped 20 kilos, I find exercise a lot more achievable.
A lot of people say that. I mean,
I'm now in the zone where I can actually start thinking, I can.
Yeah, with weight loss, I
exercise.
never talk to people about physical activity until they've lost sufficient weight. Everyone knows they should do it, and when they've lost sufficient weight, they feel they can.
Yeah, it just feels it's so uncomfortable when you are so heavy. To exercise, it's just incredibly uncomfortable and demotivating.
Yes.
And I get so inspired by bigger people that just go for it. But I'm at that point now where I think ready to go for it. So I'm interested what my next phase of this insulin optimization and weight loss is going to be for me.
Yeah, fantastic. So the reason I call it insulin optimization is because we were saying you inject insulin into your skin, and we tend to have more than we need, but enough to control our blood sugar.
Yeah.
So my idea is that we can live a life where we inject the right amount for our bodies, even though it's slightly more. It'll probably be a lot less than if we just eat the wrong food, don't do physical activity, don't understand how to prepare our bodies for going to sleep. We have body rhythms, and we have to understand how that works.
Yeah.
We have to understand that being in certain environments is, being outdoors in fresh air with lots of greenery around us is much more attractive than working in an office all day and artificial light. So we need to be aware of how that affects our ability to handle blood sugar well.
Yeah. Even being a woman, all the things we have to take into consideration.
And that as well. Menstrual cycle plays a huge part in diabetes control.
Exactly. There is some times where my blood glucose will shoot up and there'll be absolutely no reason. And then I realise, I'm during my period, and that's why I'm going to have to adjust my base a little bit.
Were you told about that in your clinics?
No,
it's
no.
Not something that exists much, is it?
No, I've had to figure that out for myself.
A lot of women say that. They say that, 1 week every 4 or whatever, they get poor diabetes control.
Oh, totally.
And nobody sort of mentioned it. It's one of those things that gets a little bit hidden.
Yeah,
but
and
I think
also,
it's becoming more common to talk about it now, which is great.
And I did do a Daphne course early on in my diagnosis.
Adjustment for normal eating. Yeah.
Yeah, something.
Normal being normal, which is 50% of your diet is carbohydrates.
Yeah. And it was helpful. There was some information in there that was useful, but it certainly didn't help me in the long run because I gained weight. I felt a sort of sense of freedom to eat as many carbs as I wanted, which maybe was a bit of my own fault as well. And it just led me down a path that I now know was wrong for me. And I'm just delighted that we met and that I've learnt so much about insulin and how the body works and fat burning. And it's actually very simple. And I don't understand why it's not given as maybe an alternative. Maybe not everyone wants to or can live this way. But it's interesting once you start it and you start feeling the benefits and seeing the benefits. Seeing it in your body, in your energy, in your vision, in your skin, in your joints. Did
you find your brain fog went?
Yes.
I had brain fog.
Yeah.
It's not good as a doctor to have brain fog.
No.
But you don't realise you have brain fog until it's gone. Strangely. It's one of those things, and when it's gone you realise, oh, that's really good, because you live your reality, and that includes a little bit of feeling a bit foggy, but you think, oh, I'm just getting older or whatever. And then you realise when you cut your carbohydrates down in your diet and you start producing this chemical called a ketone body, it wires your brain up. It's really activating for your awareness, I find, and a lot of people do.
And it was interesting on the course at Coombe Grove, meeting the other type 1 teachers, ninjas as you call them, because they're all living an insulin optimized, low carbohydrate life, and they're all doing really well. Emma, the chef, you know, her HbA1c runs at around 38, I think, on average, which is completely a non-diabetic range, and you know, she's living her best life.
Yes, I mean, I think I'm the worst, and I'm about 42 at the moment, you know, and I'm the worst of all of us, I think.
Are you? Do you still look to the HbA1c as the health marker?
I tend not to bother about any of it, to be honest, now. Okay. Because I know I can keep my blood glucose fairly flat.
Right. I'm still in the keeping an eye on it.
I think it's important when you're learning about it and wanting to make progress further. I think it's important to monitor. And nothing wrong with that at all.
So what is, you've done some research into this and you're a GP. What is the average HbA1c of a type 1 diabetic adult, let's say in the UK?
It's about 60. Which is about just over 7.5%. That's the average for England and Wales. Adult diabetes.
That sounds pretty high, you know. And my aim in life is to achieve an HbA1c as close to a non-diabetic person as possible, because then it reduces the chances of complications. 100%.
And it's possible. That's the key thing.
It is possible. Whereas I believe that the system doesn't really believe it's possible, and so is more set up to help you when your eyes do start failing, or your kidneys do start having problems, or your limbs start, you know, getting neuropathy. And I really don't want that to happen to me. I'm very motivated to...
I think we all are. I mean, complications, we're told about them almost from day one, aren't we? And so
I actually blocked them out. And I think because I think they're so far ahead in the future. And now I understand that the stuff that we do now will come and like hit us 10 to 15 years down the line. And, you know, health span is what we're all trying to achieve. Because no one wants to have a long lifespan if you're unhealthy and blind and with one foot.
Yeah, sure.
So, yeah, I've never really focused on the complications, but I now understand that if I were to run it in the 60s now for the next 5-6 years, I will probably start getting problems.
Yes, it's inevitable. I mean, it's thought of as inevitable.
But
it doesn't have to be that way.
No.
I think we don't know what the long-term outcomes are going to be, but I think generally people would say that if your blood glucose is as near normal as possible, and it's not difficult to do. This is the key thing. It's not like you have to be a monk or, you know, or a nun, or you have to put yourself on an island where you can only get certain food shipped in. It's not that restrictive. Once you get it, and when you got it, you think it's so obvious why it works. You know, you cut down your carbohydrates, which are the biggest driver for raised blood sugar. You just cut them down. That's part of the insulin optimization.
Yeah.
You therefore halve your insulin requirements straight away.
Yeah.
And because you halve your insulin requirements, you're much less likely to go into severe hypos. You might drift into a hypo as your blood sugar drops slowly, but the amount of insulin you have in your body is half at least. Yeah,
I don't think I've had a severe hypo since
That's not
Coombe
uncommon.
Grove.
There's 6 times fewer hypos on a low carbohydrate diet. Forget all the insulin optimization. There's 6 times fewer hypos. Just
you
like
drift,
carbs.
like you just said, you drift into them gently, and you come out of them gently with 1 glucose tablet usually, or maybe 2.
Yes,
to be safe.
But never 4 or 5.
But no, I used to take 6.
Did you? Yeah. 18 grams of carbs or whatever it was.
So I was on a carb coaster a lot of the time.
Yes, that's very common, isn't it? And therefore your average is not that bad but you can go really high, really low, and have a reasonable average, which is why they were saying to you your time in range is important.
Yes,
and that
depends what the range is.
Yes,
my range is quite tight at the moment because I'm.
Yes, I mean the range you aim for is between 4 and 10 millimoles per litre, which is 54 to.
I've got my upper at 7 0.8.
Yes, exactly. That's more like the normal range. But
Yeah.
for research purposes and for standardization, people use the range between 4 and 10.
Okay.
And when you get your continuous glucose meter, it will be set at those ranges for a start.
Yes.
And that is we are aiming for 75% of people of time in range, and of course you're achieving 90%.
Oh, something.
Yeah, something really high.
Really high.
And that's not difficult. So, that time in range of 90% will translate to a low HbA1c. But of course, with HbA1c, before we had continuous glucose meters, we had no way of knowing what the range was, because you'd only test 4 or 5 times a day. You probably gamed the system by just testing when you felt it was going to be normal, so you can please your doctors.
The Libra that I use, the Freestyle Libra 2, is, oh my God, it was game changing.
Yes,
it was life changing.
Yes, it's educational, isn't it?
Oh, it's brilliant. I use it and I value it massively. I feel quite anxious without it. If I ever get stuck without one.
Yes.
And now I have an Omnipod dash pump, which I'm finding brilliant as well. I love it. It's a pretty good time to be a type 1 diabetic.
From that point of view,
from technology
side, yes.
Yeah. But I know that access to this tech is really hard, and I've met a certain criteria for it. And, the hope is that every type 1 will have access to it at some point.
Yeah, they're trying to get it within the next 5 years. So by 2030, everyone
which is
should
amazing.
be able to get it in the UK, or have access to it if that's what they want to do. The thing about diabetes is all about choice, really.
Yeah.
But, the thing about insulin optimization is providing you with an option. Because at the moment you're told, and most people are told, eat healthy whole grains, porridge or whatever, eat carbohydrates, and then have small amount of fat, and then have a reasonable amount of protein.
Where did this diabetics should eat porridge?
Well, the idea was...
I haven't touched porridge.
I know, I haven't touched it for 10 years.
Like, I wouldn't touch it.
I used to have it every morning before that.
I know.
Porridge oats are meant to reduce the absorption of cholesterol. I think there are 1 or 2 studies showing, and they get absorbed over a longer period of time, say, than crunchy nut cornflakes, if you want.
Well, my cholesterol is on the high side, so
yes.
But you're never going to tell me to eat porridge to get that down.
No, I mean that's how it's got a name for itself. It's slow release carbohydrates with a certain amount of fibre, and it tends to delay the absorption of cholesterol, if that's what you want to achieve. But the only problem with porridge is for type 1, it will make your blood sugar go sky high.
Oh yeah,
it's
every time.
Highly dense in carbohydrates.
So many diabetic books make the recommendation of having porridge for breakfast because it will keep your blood sugar stable. Doesn't for me. Never did. Well, I wouldn't go near it now. Oats are like one of my absolute no-nos.
Yes, so the whole idea of eating low fat came about because that was thought to be the diet that would stop people getting heart attacks. Because there's, in the 60s, the 50s and 60s, there's a huge number of heart attacks in middle-aged, mostly men. And it was all about men in those days. That they were the people that, were more important in that, what I'm saying. And they devised a diet to think that low fat was the diet that would work well, and low saturated fat would work the best. And the reason that became the case was that when people have heart attacks, there's a lot of cholesterol in their blood vessels. But it's not the cholesterol that causes it doesn't build up. It's not like sort of furring up of water pipes when you've got too much lime in the system or something like that. That's how it's put across. But actually it furs up because there's pre-existing damage to the blood vessel. And then the cholesterol gets stuck in the
and
tissue.
What has caused that damage? Don't tell me it's sugar.
It's inflammation. It's called inflammation.
Okay.
So it's a nebulous concept, but it just means the system's always on guard, and the immune system's on guard, and then you can get damage to the blood vessels. It's often thought that insulin, strangely, is a promoter of damage to tissue.
Yeah, so it must be something to do with insulin and blood glucose. And actually my inflammation markers, which I just had checked, are in the normal range for the first time in,
Congratulations, yeah.
I don't know how long.
So often associated with damage to the blood vessels is a high inflammatory state, and insulin is one of the drivers of that.
Yeah.
Which is why people with type 1 and type 2, all forms of diabetes, tend to have higher incidence or higher rates of heart attacks than people without type 1. So it's starting to give you a bit of a clue.
Yeah.
Type 2s have too much insulin. Type 1s don't have any insulin, but when they inject it, they have to inject a little bit more than ideal. So it was thought that it's actually cholesterol that we need to remove, so animal fats. And it's fat contains cholesterol if it's animal. So let's eat a small amount of fat, and therefore we will lower the cholesterol levels, and we will stop people having heart attacks. That's called the diet heart hypothesis, and it has never been proven yet that it actually is the case. But it's still a popular sort of way of thinking, isn't it? We instantly think the fat's bad for us.
Yeah.
But that's how it came about, that people with diabetes should eat the same diet as people without diabetes, because that diet was thought to be heart healthy. Now, in reducing fat, unfortunately, something had to replace it. You can't just cut fat out and not replace it with something. So carbohydrates replace the fat. So we have this low-fat, high-carbohydrate diet. Now, we know that carbohydrates are the thing that stimulate blood sugar. But at that time, the insulin pen was developed, and a rapid-acting insulin came about, but was designed for a pen. Before that, people had mixed insulins, typically. It was probably pork, beef, and then there's some human insulins coming in. But they were mixed, so you had to inject in the morning, and then you had to cover the drop of blood sugar, and there's very little good access to testing with a biscuit or something in the middle of the morning, and then you had to cover the long acting with a lunch, and then your evening meal, the whole thing repeated. So the diabetes diet before 1980 was very restricted, and you had to eat at certain times. And strangely, you had to eat less of the carbohydrate type of meals, because it was known that they were the things that put your sugar up. But you have to have enough carbohydrates, because we couldn't measure your insulin, and we couldn't measure your glucose. So it was sort of guesswork, really. So we knew you needed carbs to keep your sugar up. When the pen came about, people said, wow, you can now eat when you like. Which must have been amazing freedom if you think about it. You're suddenly free to wander about, and when you decided you want to eat, you just injected some insulin. It was rapid acting, so injected just before a meal. It worked for 3 or 4 hours, and then
wasn't the woman who developed it, didn't she win a Pride of Britain award this year?
I don't know. That's
the woman who invented it. I think she did. Okay. My mum was calling me down, Alice, come and watch this. But you know what? I didn't want to watch it, because I knew I'd get incredibly emotional seeing the whole story of type 1 and its evolution. Yes. And I wasn't feeling emotionally strong enough to watch it. So I've never gone back and watched it. But I do believe she was given a Pride of Britain award.
Oh, good.
And it has changed the lives of type 1s, having these pens.
Yeah, I think it's been a remarkable invention.
Absolutely remarkable invention. However, the downside is it gave type 1s freedom to indulge in this, highly processed carbohydrate world that we have around us, which is not good for us as type 1s.
Of course. So the high carbohydrates in the low-fat diet.
The first thing that I did when I was given an insulin pen was buy an almond croissant. Yeah. Because I hadn't touched. The only way I'd survived and not fallen into a coma during that misdiagnosis period was I didn't touch carbs. It was the only way I could kind of manage my situation. So I was very, I was kind of craving a carb at the time.
So in some ways it
gave me license.
Of course, that's what happens. In some ways the low fat,
and it's taken me 3 years to undo that.
Really?
Yeah,
incredible. So the low fat idea promoted high carbs, and as bad luck would have it, the high carb diet came into existence for type 1s at the same time as the pen. So then they said, oh, well, don't worry about eating your carbs, because we can control it now with insulin.
Yeah.
So then eat when you like became eat the same as people who are trying to have a heart healthy diet, which has not actually ever been proven to be the case. And therefore we had to do that, because we had a higher chance of getting heart disease in the first place. Completely logical. But we subsequently know that eating high carbs has made it very difficult to control blood sugar. So now we're getting an average blood sugar over the nation. I'm sure most nations aren't much different, of about 8%. Whereas we know that if you're above 7.5%, you lose about 100 days of life as a result of your poor control. And there's a study published in 2020 to show that across all diabetes, just because of the harmful effects of high sugar levels. So that's
all these biohackers, a lot of them say, some of them say the best thing you can do for your health and longevity is build muscle mass. And then a lot of them say the most important thing you can do in your long-term health is manage your blood sugar levels and know what your HbA1c number is, that every person in the world should know their HbA1c, keep an eye on it, and keep blood sugar in check, because the impact on every system in the body is impacted.
Absolutely. So I think we just got ourselves into a little bit of a pickle with respect to our diet, and now we're understanding that you don't actually need carbohydrates.
Yes,
to stay alive.
This was
you
what
you've been on the course. You tell me.
This is what I think you said was my moment at the Coombe Grove course on day 4, where I realised. And I kick myself for not knowing this before, that the human body doesn't require carbs to survive. That they're a food group that is non-essential.
Yeah. How lucky is that for us, that the body can make the sugar it needs? Our bodies need sugar.
Yeah.
But we make it internally.
Exactly. We make it. We make enough. And I remember, you saying that people who find themselves in, disaster zones and no access to food for a long period of time can survive because the body's biological processes are creating what it needs.
Yes, absolutely.
And also, the way you talk about fat stores as being energy there for us to utilize, I think you probably know exactly how many calories worth of fat you have on your body. And, I've certainly got a lot here that would keep me going for a while.
Yes, and that's the thing about optimizing insulin. So if you don't need carbs, you can just eat fat and protein. And we know that if you're not eating carbs, you're therefore not stimulating insulin, so you don't need as much. And the key thing about that is, therefore, you're not storing fat.
Exactly.
And that is the key to it. So if you're not storing fat, you're allowing your body to burn it.
I know.
And that is the thing. So if you can drop your insulin levels, you're allowing your body to burn fat. And therefore, you will lose weight in a healthy way, because you will still be providing your body with enough calories from protein and fat. And it's not a starvation diet. It's not.
Definitely not.
If you have an eating disorder, you'll have a greater chance of having an eating disorder with type 1 diabetes, because you're concentrating on food all the time. But stopping insulin is not a good idea.
No,
because
never.
you will force your body to burn fat in an unhealthy way.
Well, I'd end up how I was when I was diagnosed.
So that's dangerous. But
I lost a lot of weight, but I was,
of course,
on death's door.
Yeah, sure. But of course, you'll be able to replace your calories with fat and protein, and then your carbohydrates will be made by your body as required. So you can keep a very good glucose profile by allowing your body to burn fat. And the best way to allow your body to burn fat is to reduce the amount of insulin you need to inject. So if you reduce the insulin you inject, you're allowing your body to burn fat and produce ketones.
Yeah.
The reason that's important is not just because you want to burn fat. It's because the ketones are biologically active chemicals in their own right. They regulate the immune system. The ketones actually are self-regulating in amount. So that's why you'll never go into diabetic ketoacidosis as long as you're injecting insulin.
Yeah, let's talk about that, because that's what my diabetic doctors worry about with a low-carb lifestyle, is that the risk of diabetic ketoacidosis is, rises. But it's just not the case, actually, because if your blood sugar is low, it's an impossible state for you to get into. It's only when your blood sugar is high and the ketones are high that you're in the risky zone, right?
Yes, absolutely. As long as you're injecting insulin and it's working, you're never going to go into diabetic ketoacidosis. I did a long cycle ride where I was actually measuring ketones in real time with a real-time ketone meter, very much like the real-time glucose meter.
Was this your most recent?
Yes.
Escapade.
It was.
Let's talk a bit about that. Well, you do these extreme.
I was doing a trip to Switzerland because I went over there to do a talk on sport and type 1 diabetes. So I thought, what better way to arrive than on a cycle? So I cycled from the UK to Switzerland, and I thought, well, I'll do a demonstration of ketones and glucose and a keto type of diet, or a minimal insulin diet. And that was completely successful, 18 days of that. And I'll be writing that up in a book, hopefully. So it'll give other people an idea of how it all works.
So you were eating, you weren't fasting?
Oh, completely eating a normal, I was eating enough calories.
Because you did another
I
thing
did a
where
fasted run. And that was way before that. It was in 2019 or something like that. Where I was so frustrated about the lack of progress with this idea of cutting down carbs that I organised a group of people to run 100 miles in 5 days. That's 20 miles a day with no carbs at all. We just drank water and salt.
So no food?
No food at all.
Yeah.
And that was to prove a lot of things about type 1 diabetes, which was successful. And we had 2 people with type 1 diabetes doing the run out of 8 of us. And we had perfect control all the way through.
And enough energy. Because you were using
more than enough energy. But
ketones.
The thing is, our ketones were measured twice a day. Everyone measured their ketones. And there are 8 of us, so we had 5 days times 8 times twice a day. And when you aggregated all of the ketones on the graph, you could not pick out the person with type 1 diabetes. So it shows that it isn't a risk.
Do you remember what your ketone number was showing?
Yeah, they
on
went
the meter?
up for about 3 to 6, that sort of level.
Okay,
That was
which
the same with everybody
would
else.
be kind of danger zone,
emergency,
go to
blue light,
hospital
zone. Yeah, but because our blood sugar was around 6 all the time,
you knew that there was no
perfect.
DKA happening.
But when I did this cycle ride, also I had this time when my glucose was going up, my ketones were going up, and I thought, well, that's okay. I've just not taken enough insulin, because you can also be in a state when you're minimising insulin, you might not be taking quite enough. So my ketones were going up. So I thought, well, that if I keep doing that, I need to inject insulin, which is fair enough because, like yourself now, you've learned that when your sugar goes above 8 or 9, you do a corrective action on that to bring it back down as quickly as possible. And it's not a big deal. That's just part of normal life. But I injected just 1 unit of insulin and my ketones went from 3 to 0 in an hour, which shows how potent an inhibitor of ketosis insulin is. So as long as you're injecting
I've noticed
insulin,
that.
Yeah,
I've noticed that in myself. Yeah. It's really hard to get into burning ketones.
It is. So
not burning them, burning fat, producing them.
Yeah. So you have. That's why insulin optimization is so good, because if you can get into ketone burning, it is a bioactive molecule in its own right. It's not just an energy generating molecule. But neuronal tissue, especially nervous tissue, likes ketones. We've got good examples now of people with bipolar disease who recover very quickly on a keto diet. And there's some good stuff online with respect to that. So I always think, well, if I developed, say if I didn't have type 1 and developed bipolar disease, 5 times increased risk of suicide when you're in your low phase. I discovered a keto diet and made it better. And then I unfortunately developed type 1 diabetes. What would I do? Well, I would want to stay on a diet that kept my mental state stable. But my specialist would be saying, well, you can't do that because you're going to go into ketosis and stay out of ketosis. So it's going in the future to generate some clinical conundrums where we're all going to have to get our heads together and work out the best solution. I know what I would do. I'd say stay on the keto diet and we'll manage your type 1 around that.
It's fascinating stuff.
Yeah.
We've been talking a lot. My brain
We're talking about ketone bodies, really, aren't we? And how bioactive they are. So the only way you're going to get into ketosis, you said it's difficult to get into ketosis.
Yeah, I was going to ask you about the carnivore diet.
Right.
I've not tried it. Have you tried it?
Not really, no, but it's easier to maintain blood sugar with a carnivore diet, almost certainly, as long as you grade your protein, because protein does actually put blood sugar up.
Yes, I have to inject a bit of insulin to eat
people aren't
told
that. You have
I had to figure that out for myself.
Yeah. And it's quite a potent macronutrient, a potent food substance that raises blood sugar. It's about half the effect of of carbs. So it's
I figured it out eating chicken shish kebab and salad, thinking I was, not needing to inject anything for it. And slowly, it started rising quite significantly over a longer period of time. But it did go up, and that's when I realised I had to inject for it. But definitely wasn't really told about that. So the Daphne course touched on it, I think, from memory. But the focus is very much carb counting. So what do you, I'm interested to know what you do, what you eat on a daily basis.
Okay, so as we speak now, it's about 2:00 in the afternoon, and I'm yet to eat. I've had 2 cups of coffee. One of them's had a tiny amount of cream in it, and I'll be eating probably after this, and I'll have 2 meals a day. And my next meal will probably be something with meat or nuts in it, possibly some hard cheese, although it'll probably be that sort of thing. I won't go for any green veg or salad because I'm on the hoof at the moment, so I won't be sitting down or going to a restaurant. I'll be I'm on the hoof, I'm going to catch a train shortly and blah blah. And then I won't have anything till the evening, and that will probably be meat or fish, and then it will be leafy green vegetables. If I have a salad, it will be olive oil dressing with no balsamic vinegar, although there's not much carbs in that sort of thing.
Yeah, I don't touch balsamic. I have my apple cider vinegar.
That's right. Yeah. Things like that. So it'll be that. If I want something sweet, it will be 90% dark chocolate or at least 85% dark chocolate. Berry fruits are very, very good. So tiny amounts of berry fruits, a small handful. You don't need a bowl full of berry fruits.
No.
Things like that. I wouldn't touch bananas, oranges or apples. Because they're a little bit carby, although some people do build that into their...
Yeah, I avoid it.
Yeah.
I don't think I've had fruit all year.
Yeah.
Do you know what? I've actually even avoided berries, but I will reintroduce berries, just a few. I developed a funny feeling around berries when I was in my misdiagnosis phase.
Yes.
Even 5 raspberries would give me a spike.
Really? Yeah.
That's how deficient in insulin. It wouldn't happen now because I've got insulin drip feeding into me all day long in the background.
Yes.
So I can now have a little handful of berries and it's okay.
Yes.
But yeah, I've tried to stick to a keto. Well, listen, I cycle in and out of it. I maybe have a week where I'm really on it, and then I'll have a bit of toast, and then I'll sort of get back into it.
Yes.
I'm probably not as strict as you are.
But I think the key thing is and that's all that matters. We all know what a good lifestyle looks like, and we all break it from time to time.
Yeah, and
that's
I
called
think
being a human being.
I was going to say, did I have an ice cream on holiday?
Great. Good for you.
Do you know what? I didn't, but I remember thinking a lot about it.
Yes.
But I did have some nice bread on holiday. Dipping into things.
Yeah.
But I never stay in that pattern for too long. And I was going to say I have a spoonful of rice from time to time, but actually I don't. If I'm bringing carbs into my life, it's usually a slice of bread, freshly baked sourdough or something. But that's occasional. That's a treat.
You have to work out the amount of carbs you want. For me personally,
I have about 50.
A low amount suits me. The definition of a keto diet is 50 grams of carbs or less. Some people say it's even 30 grams of carbs or less a day. The average
I'm probably
is
between 50 to 70 a day.
Right, yeah. I think 100 or less is most people do quite well on. 100 will not get you into ketosis that easily.
No.
The lower you go, the more easy it is to get ketosis.
Yeah. Intermittent fasting is great. I often do something similar to you. Don't eat in the morning, have a black coffee perhaps, and then eat around lunchtime.
Yeah.
And try and have 2 meals a day.
Yes, that separates the protein, because I think the protein can cause problems if you eat it in one hit, certainly later at night. Because late at night your body's getting ready to go to bed, and the last thing it wants is to have to process a whole load of food in its tummy.
Yeah.
But, sometimes you will be eating late at night, and so what? It's sociable. Yeah. It's more healthy for the mental state to eat late at night.
And I have menstrual cycle to take into consideration, and that changes things slightly for me.
So I think it's fitting